And we have a session in the second half once the presentation is done to address all your questions and queries, technical as well as other grievances. So thank you. And in the interest of time, let's begin now. Good evening, everyone, once again. As you know, we have convened for the Ayushman Bharat Digital Mission's webinar on the Healthcare Professionals Registry. Today, the flow of the presentation in this webinar is going to be such that we will talk about why there was the need of ABDM, how did it come about, what was the thought behind it, and also look at what has been achieved so far in terms of the status of the mission since its inception, very briefly. Then we would be moving on to the benefits for physicians and healthcare professionals at large in the context of both quality of care delivery as well as in the context of the larger healthcare ecosystem being digitized and the benefits of that. After that, we will move on to some frequently asked questions, which the team at the National Health Authorities end has been receiving from various healthcare professionals and pilot projects that we have been running, which we would like to address at the outset. And then the second half of the session will include a live demonstration and a walkthrough of how do you log on to the Healthcare Professionals Registry portal on the ABDM website, and then what are the steps to register. And finally, we will take any queries and grievances, especially in the technical process of filling out the forms and filing the application, as well as around larger concerns and other queries that the fraternity might have. So the time split up would typically be about 20 to 25 minutes for the first three halves, and then we would move to the registration, live demonstration, and the queries. So the first part, like I said, is why should we register on the ABDM Healthcare Professionals Registry? What is in it for healthcare professionals to actually register and be a part of the mission? Um, I think this is very important to understand in the context of what is the background and why did ABDM the mission come about? And the story goes as identifying the needs of healthcare stakeholders in India was the primary genesis. Where if you think about it in terms of the primary stakeholders, which is a care seeker and a caregiver, there were different challenges that each of these groups faced, right? Um, for example, a citizen thought, how can I find the right doctor for my ailment? They also thought, oh, I've misplaced my prescription. How do I share my treatment history with the doctor when I visit a new one, or even the repeat visit to the doctor I've been seeing? Something as simple as I am miles away from the nearest hospital, but is there anything that can be done so I can be treated right now, right? Similarly, if you look at it from the perspective of the caregiver's side, as a physician or a healthcare professional, um, if they had thoughts like, I want all the citizens in the locality to know where to find me if they need me. If the patient had a medical record of history, I could start treatment without wasting time on how can I afford focusing on signing off on these health insurance claims or other kinds of administrative tasks while more patients are waiting for me? So, when these kinds of challenges were witnessed in terms of the needs of the healthcare stakeholders in India, the genesis of ABDM came about at the right time to unify these stakeholders by bridging these gaps in their needs, right? So, premises of accessibility, finding the right doctor, the patients being able to find the right doctor, and the physicians being able to find the needy patients. The problem of efficiency in terms of not wasting further time before the quality of quality care is being delivered, and the solution of affordability in terms of being able to visit a doctor or consult a doctor from the comfort of their homes, or focus on care delivery as opposed to other administrative tasks, as affordability in terms of the doctor's side, was where the genesis of ABDM came about. Now, with that background in mind, it is very important to understand how is then ABDM being implemented to bridge these gaps and solve these problems. Like you can see on your screens, there are three particular groups of stakeholders that need to be digitized and be connected to each other in the context of digitization of the ecosystem, right? You have the citizens, you have the professionals, and you have the various healthcare facilities, big and small, government and private. So the first step in this context is digitizing their healthcare identities, right? So for us to be able to find each other and connect with each other to avail different kinds of healthcare services, it is important that each of these groups has a digital presence, a digital identity that helps them get interconnected and talk to each other. So this is the context in which the Ayushman Bharat Digital Mission has come up with the Ayushman Bharat Health Account, or ABHA as you know it, for the citizens to make their healthcare accounts and store or connect their records safely at their devices or whatever format they use in terms of an application to keep it digitally with them. Then we have the Healthcare Professionals Registry, which will be the focus of this call and webinar in the next few minutes. To digitize the presence of doctors, physicians, nurses, and the larger professional fraternity. And finally, you have the Health Facility Registry, which makes the presence of brick and mortar or even teleconsultation facilities in terms of a digitized identity on the ABDM ecosystem. Then, once these identities are achieved, the next big step becomes how do we make the functions for each of these people digitized, right? So, for example, the patients need to have these digital records that are being generated by doctors who are healthcare professionals verified under ABDM, are visiting facilities that are a part of the ABDM ecosystem. That is where the Abha Personal Health Record app is being developed as a reference application, and other ABDM enabled personal health record apps are also available to be able to utilize this functionality of having our records and medical history handy for the citizens' ease of continuum of care. Then you have the professionals. Now, the day-to-day practices as well as the generation of these records that we've been talking about requires healthcare professionals to use ABDM-enabled digital solutions to write or type these prescriptions and digital records out, right? So, some acronyms you see on your screen then, for the benefit of the audience that may not be familiar with these terms, include the electronic medical records, electronic health records, or larger health management information system applications. Uh, if you have any of these kinds of ABDM enabled software on the digital system, whether it is on your mobile applications or on a desktop or a web application, then it is easy for you to generate these records and link them with the patients or citizens' Abha for them to be able to access them and store them in their PHR apps at their end. Finally, the same thing with respect to the healthcare facilities, digitizing their day-to-day functions end to end in terms of both their professionals being able to use ABDM enabled solutions as well as their patients being able to access ABDM enabled solutions makes the facilities also an important element of the functionalities being digitized. We will come to more on this in the context of what are the various benefits. But in the interest of time, I will expedite and just talk about how the last leg in this, once the digitization of identities as well as the digitization of functions is achieved, makes for the larger goal of the Ayushman Bharat Digital Mission. So this is where we understand the health information exchange and consent management gateway, which is a secure gateway that has been built by the ABDM mission and implemented by the National Health Authority to be able to enable ease of information exchange with respect to patient records and history, purely based on their own consent. And then you have other functionalities and features that have come up of late and are being built with very, very rapid speed to supplement partners who have already achieved the first two legs, which is the unified health interface, the health claims exchange, and the QR code based scan and share OPD registrations for faster OPD registrations for patients. So this is a slide which may be a little intimidating to some of us because of the heavy jargons, but let me break it down for the benefit of the audience. And what we are trying to talk about here is all the functions that we saw in the last slide across patients, healthcare professionals, as well as facilities. What are the various ways in which they can benefit us is what the slide is trying to talk about, right? When we talk about the unified health interface, it is talking about telemedicine APIs where you can discover physicians, book appointments from the comfort of your home, and even consult should they have the facility of teleconsultations. Uh, Discover labs, discover pharmacies, try to identify bed availability, and so on and so forth. Um, as a physician that is looking to promote their presence for patients to be able to easily find them and for patients to be able to easily connect to doctors and book appointments should they need it. The information exchange and consent management gateway, we just spoke about it. This is more in the context of if I am in facility A in city X. If I were to travel tomorrow or move to another location where I want to continue my treatment, but it is important for me to share the records or for the next facility B in city Y to be able to accept what I'm sharing or what my history suggests in terms of diagnostic reports and prescriptions. There should be an ability where if my consent as a patient exists, that the second facility or physician can access these records in order to stop wastage of further time for repeat consultations. And that is where the genesis of this idea came in. Health claims exchange is everything with respect to the idea of insurance processes being digitized end to end. The idea that health claims, in terms of the bulk of paperwork that it takes, both in terms of the burden for patients to file them and in terms of the physicians to approve them to be reduced and focus being shifted on the quality of care. And finally, the scan and share mechanism, which is already live in many facilities across the country, where the patients can simply scan a QR code to be able to fill the details, or if they already have an ABHA ID, generate an OPD slip instead of waiting for hours in a queue to book an appointment and get a slot for an OPD view, right? Of the things you see on the screen, columns B and D are very much live, and many ABDM enabled partners are already availing this. Columns A and C are fast being built and very soon going to be live and are going to be things that you'll see in the next few months. So this is just a very quick overview of how much progress has been made to say that we are not talking about one or two patients having IDs or 10 or 15 doctors agreeing. The numbers are huge, they are fast growing, they're changing overnight, and we have more than 34 crore citizens in India having their Aadhaar numbers ready. We have more than 2 lakh healthcare facilities that have registered with us, and some of them are also already using ABDM enabled solutions, and many others are ready to get their solutions if they're already using them integrated with ABDM. And the rest of the numbers on your screen speak volumes about people's interest and promise in the mission and the value of digitization of healthcare. Now, as promised in the beginning of the call, I'll very quickly move to what is in it for physicians and healthcare professionals in terms of them willing to digitize their practice and what is it going to mean for them once all these different solutions that I mentioned to you are live. So, getting registered on the Healthcare Professionals Registry once shall enable patients to find you on all healthcare apps which are using the ABDM ecosystem, where you will be seen as a physician, as a verified doctor. To say that then your discoverability in terms of people being able to find you becomes more, and the patient's ability to find the right doctors and physicians in their vicinity as well as elsewhere based on the specialty that they're looking at becomes much more seamless. You have efficient diagnosis and treatment because, like we have been discussing, the longitudinal data and the medical history will enable efficient and accurate consultation as opposed to critical time being wasted on repeat consultations or repeat testing, for example. The patient satisfaction is, of course, going to get improved because of, as we just discussed, lower patient wait times, for example, in the scan and share feature. You save time with respect to having paperless records, prescriptions and discharge summaries, because then you can focus more on patient care. Finally, something that is really important and critical in terms of moving away from preventive healthcare to promotive healthcare, the follow-ups and referrals become easy because you can track the progress of patients and referrals for repeat visits to yourself as well as to other doctors should you think they need to visit them for other ailments that they are experiencing. The second thing that I want to highlight for the audience here today is that the mission is time critical in terms of having everybody digitized in the ecosystem for realizing the full breadth of the benefits that we are talking about here. And to that effect, the National Health Authority has been closely working with a lot of software as a service based ABDM enabled platforms, both government and private for lower costs of digitization to promote digitization as an exercise. Some options are on your screen right now. For more, we please request you to visit the ABDM partners page and try to explore various options that are available and reach out to these partners for availing their solutions or getting a demonstration of their technology products. Similarly, we realized while we are asking all of our partners to drive down costs, it is important for them to be motivated to do that as well, to realize the full benefit of digitization. And to that effect, the Digital Health Incentive Scheme is also live, where there are incentives for health record generated and linked with the Aadhaar address of a patient. It has been in effect from 1st January 2023. There have been some changes and updates in terms of the eligibility criteria, which are going to be live from the 1st of April 2023. So we urge you to please go and witness the breadth of what the digital health incentive scheme has to offer. Finally, before I move on to the live demonstration and hand the mic to the technology partners from the National Health Authority, Mr. Shashi Prabhakar, who's going to talk to you about it. Few frequently asked questions. The first one on your screen, as you see, is healthcare professionals are mandated to register with their respective councils. Is there a need to enroll in the HPR again? Why can't the HPR accounts be issued all automatically? So, the answer is on your screen, and for your benefit, let me please reiterate that registration on HPR is purely voluntary and it will not replace the existing registration by the respective councils because the NHA is not equipped to do that. However, it is only to bring together the digital identities and give a sense of the qualifications of participating professionals from all states on a single platform, right? So this becomes a primary identifier of you as a healthcare professional that is willingly actively participating in ABDM. So, should you wish to avail these services, you can do so by enrolling yourselves in the Healthcare Professionals Registry. Now, to the part as to why can't they be done automatically and interlinked with all these other respective council registries. Though there have been efforts, the issues that we have identified is that the process for registration vary greatly by the state, and changing that might take decades even. So, a separate enrollment has been put in place to ensure that a standard set of attributes are captured, and you do not have to wait too long to avail the various benefits of ABDM. What is the role of the National Health Authority in the Healthcare Professionals Registry? So, like I said, NHA only provides the technology platform. The data is entered by the healthcare professionals and it is verified by their respective councils and authorized bodies because they are the best equipped people to do so. Registries generated in this manner, whether it is the HPR or the HFR, are being used as building blocks for providing the other services, paperless services that we talked about in the beginning of the webinar. The third question, what kind of information is gathered? Now, this is something that has been coming to us recurringly across various, modalities as to will different kinds of sensitive data be captured? The answer is no. The Healthcare Professionals Registry follows a very minimalistic approach. It only seeks information necessary to verify the identity and the qualification of a healthcare professional, because we are promising the best to the patients and promising the right quality of care to the patients in this whole ecosystem, right? So this only then includes demographic details, contact, registration, academic, and place of work related details. It does not collect any financial or other such sensitive data. You can view the form for yourselves and get this myth busted, because it doesn't exist. Such a question does not exist in the form, and neither do any of the digital technology solutions you would be using as HMIS, EHR, EMR apps collects these data without the consent of the professionals themselves. Finally, the last question, and then we'll move to the live demonstration, is if you're having issues while registering to get registered on the HPR, who do I need to contact to resolve these issues? You can visit grievance.abdm.gov.in or dial the number on your screens. However, we are hoping for those of you who have joined the call today, we would be able to solve some of this through the live demonstration as well as the queries. Thank you so much for your engaged participation in this segment. I would now like to hand over to Mr. Shashi Prabhakar, who joined us for the live demonstration. Shashi, over to you.
Anvesha, let's take a few questions. Give the floor a chance to ask a few questions.
I think we can, sure, sure. Maybe we can type on chat, Sanskrit, and then we can move to the Q&A. Would that be all right?
Sure. Okay. There is already one question, hence I'm saying.
Yeah, if there are any question, we can attend that. After that, we
Yes,
can move
yeah,
to the live demo section. No issues.
sure. Thanks. So let me quickly read the question out for the benefit of the audience. EHR. Shashi, the question is in the context of ABDM enabled EHR apps. We have a provision to integrate APIs for generating Aadhaar number by other companies for users. Do we have similar provisions to generate HPR by IDs by private startups or health tech solutions? If it is present, can you show the process for that? If no, can we pull the data input of HPR ID of a doctor? Shashi, would you like to please address this question?
I'm just reading it once again. Hi there. So our team is working on generating some new APIs. So this system is not currently in our existing scheme of things, but we are working on this API. The API design document has been made and is under approval from the senior leadership. Once done, this API will be open to all, and the private integrators will be able to generate HPR ID and able to create health profiles based on their repository. So you can expect this in the coming month. It will take around a month. Thank you. Any other
Okay,
questions?
thank you for
Yeah.
your thank you for your sorry, my mic is working. So thank you. We are building a similar solution. We don't want doctors to have multiple registration process. So I am thinking of it. Thank you, thank you. I am expecting that as well.
Okay. Any other question you can post in the chat window, or I think someone has raised their hand.
No, I guess that was
I
the
think it
same
was
person
Mr.
raising their
Uday.
hand.
Okay.
We
Okay,
can
Mr.
take one
Gaurav has
more question. Yeah.
Yes, I have a question. It is an old question, but I am asking again. I am from West Bengal Health, and I want to know there is some paramedical staffs and which are left, which are I have raised a query that they are cannot register themselves because there is no option for paramedical staff. So
Okay.
when it will be included in the HPR profile?
Sir, this is under review by ministry. So Ministry of Health is having a discussion regarding AHPR, and there are around 56 categories in that. So an interim committee has been made around 2-3 months back, and once that will be formalized, those categories will be enabled in our system as well. So this might take some time. So this is
Okay.
based on the approval from ministry. Once we get the approval, this process will start.
It's only pharmacist council and paramedical council. These two are missing from the list, but we have much more.
No, these are
In
two,
this
three that you are
designation.
mentioning, but there are total 56 parameters.
Okay, okay. No, I'm telling about
categories.
the West Bengal here, from the West Bengal. Might be in other states there is.
Yeah. Thank you, sir.
Okay. Okay.
We can take one more question and then we'll start with the live demonstration. Rohit, Dr. Rohit has his hand up.
Sir, you are not audible.
Hello, am I
Yeah.
audible?
Yeah, to some extent.
Okay. Hello, it is clear now.
Yes, sir. It's better now.
I want to ask one question regarding if I am registered with any privately used PHR app, then again I need to register myself on this registry.
Sir, when you are registered on that private app, whatever you are mentioning, so
Okay.
for that PHR app, that data we don't capture in the HPR. So both are separate things. So this HPR is Healthcare Professionals Registry. Here, repository for all the healthcare professionals is maintained.
Okay.
This is different from that. This is different from that PHR app database.
Okay. So
Here
even
exclusively
if,
we have the data for doctors, nurses, and some paramedicals, which will be further included in the further enhanced in the coming months.
okay. So what I understood is the PHR app is not even if they are ABDM compliant. I need to register myself as a separate
Yes, sir.
registration.
Yes, sir.
registry.
Both are different things.
Okay. Thank you.
Okay, sir. Thank you. So should I give the demo first or should we take
Yes,
some more
yes.
questions? There is one more
No,
question, I
Shashi, let's
suppose.
do the demo first. I request everyone to keep posting their questions in the chat and we'll keep answering them in the chat itself. And then after the demo, we'll be happy to take more verbal questions. Thank you.
So is the screen visible?
Yes.
Okay. So this is the URL hpr.abdm.gov.in. This is the live URL on which you can do your registration. So here it at the right hand corner, you can see admin login. So we have to go and log in here. Click here for login or registration. If some of you are state verifiers or national level verifiers, you will have to go to the admin login and log in through that admin section. But for most of the users, the doctors who are registering, they will have to click here for login or registration, this section. So once you log in, if you are a new user, you will have to enter these details, your registration detail, registration number, the category, whether you are a doctor or nurse, and subcategory. So once you select all these details, so in doctor, we have 7 categories and in nurse, we have 4 categories. So once you select these categories, you will be taken to your HPID will be created and you will be taken to the HPR page, the already existing page. So by using your HPID or your username, you can log in here.
है वाईफाई ऑन उसका हाँ?
So I'll just log in using my OTP. This is the Aadhaar enabled OTP. Yeah, so this is my profile. So I have already completed my profile. So in your case, if you are using it for the first time, you will be redirected to this page and this eSign HPR profile won't be visible to you. Once you complete the profile, then this section is activated. So there are 3 sections where you have to fill in the information: personal details section, registration and academic details, and work details. So there is a salutation of Dr. Mr. Miss. And do you want to show a different public picture? If you want to show a different public picture, then you will have to select that picture. Your first name, middle name, last name, this is automatically populated from the Aadhaar database. You can enter your father, mother, spouse name and nationality and the languages which you are comfortable speaking. So you can enter the languages and your address as per KYC will already be entered here. And if you select the communication address is different from this address in the KYC section, so it will be, you will have to enter these details. And if you select both the addresses same, then it will be auto-populated from the already entered Aadhaar address. So in the contact information section, you can mention your mobile number and email ID. Here it's written that should your mobile number be same as your official mobile number, the public display. So you can change and give a different mobile number if you want that to be shown in the public display, because some of the sections can be displayed in public section. So for that, we'll be taking your consent in the last page and we'll let you know that which are the sections which are seen, and you can select which are the section. There's radio button given in that section as well. So once you save and next, click on this button, you will go to the next page for registration and academy details. As I have registered by mentioning that I am a doctor, so the 7 systems of medicine will be mentioned here. So you'll have to select whatever is valid for you, and accordingly you will have to mention the registration details, the council with which you are registered with, your registration number, and if there is any expiry date for that till the time that registration is valid, and whether it is a permanent or renewable one. So once you have done all this, you can upload your registration certificate. And if you have already that in your data DigiLocker, so you can directly pull it from there as well. If your name is different from the name already mentioned in the system, you can change that by selecting on the option is your name is different, and then you will have to upload a document for that. Any Gazette of India document or any legal document where the name change has been done. So you'll have to upload that too. So the upload limit for all the documents is 5 MB only. So you'll have to keep a note of that. If the document is heavy, you will have to shorten or reduce the size of that document. So after the registration details, you have to enter the qualification details, whatever is your degree, country, state name, university name, college name, and month and year of awarding the degree. And after that, you can upload your document here. And here also you can pull it from DigiLocker. Once it's done, you can go to the next section, save and next. In the last section, the information about the work details is captured. So you can mention about the specialty and subspecialty, whatever you want to mention, and your current work details. If you're working, then you have to mention yes or no. And if you're not working, then the reason for not working will be populated here. You'll have to select out of these 4 or 5 options given. If you're working, there is option to select whether you're working for government or for private, or you're working for both of them. So for government and both, you will have to upload any document mentioning that you are working for government sector. So the documents which are eligible, which some of the documents are appointment letter, recent payslip, or transfer order. So these are the documents that can be uploaded. For the private practitioners, this is not required. So after this section is done, you can mention the place of work, whether you're working in any facility or organization. If you're working in any facility or organization, you can mention that, you can link that, this data is, you can select any facility. If you want, if you know that that facility is already existing in the HFR, health facility registry, you can select that facility and you can directly select that and you can link that facility with your current work details. The last section in this page is regarding teleconsultation URL. So any person, any doctor who has been registered, who has registered on this HPR page can add their teleconsultation URL, and once verified by either council or work verifier, once the profile is verified, that person can start teleconsultation as well. So the last section is regarding preview profile. So here you can mention something about yourself and your years of experience, qualification. If you want to change the profile picture, and the last section is about declaration. Once done, this profile is sent to the respective council for verification. So you will receive a SMS and email notification mentioning that your profile has been submitted for notification. And after this is done, you can e-sign your HPR profile by using your Aadhaar number or a virtual ID or UID token if you already have generated one. So this is the complete flow. So now we can start with any queries or questions if you have any. Hello. Am I audible?
Great questions. Yes, yes. Thank you so much, Shashi, for that. Great questions in the chat. If anyone else has any questions, yes, Dr. Mohit, please go ahead. You're on mute, Dr. Mohit.
Hello. Hello.
Yeah,
Yeah.
you are audible, sir.
Yeah. First of all, thank you so much, the NHA team, to just organize a very, informative session with all of us. And I have one question that if HFR registered, and in the address section, there is a sections for uploading photo, building photos, and the one more, there's address proof. Okay. So on that case, if someone is had a address proof on the previous location that right now he don't have a proof, so that rent agreement is equivalent to the applicable for the HFR registration or not? When if a person upload the rent agreement. Hello.
We can hear you, Dr. Mohit.
Sir, this question was pertaining to HFR, I suppose.
Uh,
Hello.
Shashi, I will. Yes, Shashi, I believe he's asking about the images of the building and all.
Yeah.
So it
So
is
that section, yeah, that
HFR
section is an
related.
HFR. Yeah.
Yeah.
So if you want, we can get back to Sanskriti or Anvesha, and we'll get back with the answers, and they'll just revert back to you if it is still there.
Regarding HPL, can I ask one question?
Yes, sir.
Actually, I want to know without council without council verification, any other verification can be done without council verification.
Yeah. For government officials, work verification is also done. For private
What
practitioners, for
well,
private
government
practitioners, yeah, for
what
private
what verification you're
practitioners,
telling? Government? You're telling? I can't hear your voice.
Let me complete, sir. For
Mhm.
private practitioners, only council verification is done.
Mhm.
For government officials, the council verification as well as work verification is done. So
Government will-
either of that will enable your profile to be displayed in the public.
Okay. Okay. Can you repeat the process of council? How can council will verify this? Can you
Once
repeat the
you
procedures?
once you register your
Suppose
profile,
okay.
once you register your profile, that is submitted to the council. It automatically goes to the council. So the in the coming week, the list of verifiers will also be uploaded on the website. It will be shown to the public. So if you already have the number or contact details, mobile number or email ID of the verifier, you can directly coordinate with them and
No,
ask them to expedite the process.
Actually, I'm asking that verifier has not been assigned in our in West Bengal. Actually, it is on the process. That's why I'm asking
Okay.
you how
Okay.
this verifier
Okay.
can be assigned.
Okay.
Asking about
So
this.
all the applications are tagged with West Bengal. Once a verifier will be assigned, so this pending application will be shown in his dashboard. So that person can go and verify them all those
Okay.
applications.
Okay. Okay.
So if you want, we can share the template with you, and you can share the details with whomsoever you want to be the verifier for West Bengal.
Okay. Can you share that one?
Yeah,
That will
yeah.
be very much helpful to us.
I'll share that template. Can you drop your email ID or mobile number here? I'll just communicate over the email only.
I am dropping my email ID.
Okay, that would be great, sir.
Mr. Rohit, I see your hand raised. Do you have another question, sir?
Yes, I want to ask a question regarding the timeline. How much time it takes any doctor to have verified profile?
Sir, it varies from 1 day to even a month. So it depends on how proactive your counsel is.
Okay.
Because the verification or validation is not done at NHA level. You just create the profile and then it is sent to the council. So the council people in some of the states we have seen that the verification happens in the same day when the profile is submitted, and in some states it is pending for even more than 1 month. So it varies from state to state.
Okay, so can I have that estimated time? I mean, state-wise estimated time. How much time the state councils taking to verify any doctors?
Sir, we haven't
Can I have
calculated
that?
that. We haven't calculated that, sir.
Okay, okay. So for particularly in Gujarat state, can you tell me how much time it takes for Gujarat Medical Council?
Gujarat doesn't take that much time.
Okay.
As per our observation, they do it within a week. If
But,
there is no query, then they do it within a week.
But is there any initiative to make it a standard time frame? Because if all the states have different SLAs, then how?
So that totally comes under the jurisdiction of different states, and we can't force them to follow a certain timeline. Although we ask them to do it within a week or as early as possible, but we are not in a position to force them.
So it has to drive from the state level.
Yeah.
Yeah.
Gaurav Banerjee, yeah, I saw your email ID, gaurav.banerjee@in.ey.com. So you are
Yes.
representing EY. And
Yes.
are you providing some sort of PMU support to West Bengal, or in what capacity are you
No,
working with them?
you just send regarding the mail ID you are asking. No, that's why I'm sending my email ID. Otherwise, I can
No.
send my personal email ID also if you want.
No, but okay.
As you want.
So I
I'm
just
just
wanted.
asking for that. No, I will discuss with my actually West Bengal Health is our client, and I am
Okay, okay.
representing
So
on behalf of them.
Okay, okay.
Then I click on the notification pane maybe.
So any more questions, or should we take the question posted in the chat?
Can I ask one thing? This is not regarding HPR, regarding HFR, whom to connect? Because we have some query regarding that.
We also have Dr. Beneath with us. He'll answer your queries.
Okay. Can I ask now or?
Yeah,
later
you
on
can
I
ask
have to
now. You can ask now.
Okay. My first question is regarding if any facility manager change one post to another post. Means suppose he is in facility A and he moves to facility B. Some new person has came to facility A. So this transfer process is not working. What you have connected before somebody has instructed how to do that, but this transfer process is not working fine. So how to do the same? This is my only question for HFR. It is not happening smoothly.
As per your question, the transfer functionality is working fine. The existing user who is being transferred to another position or another place, he needs to
Okay.
raise a request of the transfer facility from the
Yes.
dashboard itself. There's a option available over the dashboard in the name of transfer facility. Okay, transfer request. He needs to click on that icon. He needs to select the facility from the drop down icon and needs to type in the HPR ID of the new person to whom he is willing to transfer the facility. And he
Okay.
needs to click on the request button. Then the request would be generated to the new facility manager. He needs to accept the incoming request of the facility. Post that only the facility would be transferred to the new facility manager.
Actually, sir, this request has been raised, but after that post request, the verifier or who will approve this? This is the main problem we are facing.
This doesn't require any verification process. It is an interaction between two two facility managers, one at the receiving end, one at the sending end.
Then,
The receiver needs to approve the request of the incoming facility.
but the receiver is not getting this message. Where they can check this message? This is
Transfer
the
request
main
section.
problem.
In the transfer request section, the approval status can be checked. Incoming
Okay,
request can be checked.
suppose I am a facility manager, you also facility manager. You are raised a request for the transfer, and I have to approve it. Right?
Yes, you need to log in into your
Okay.
facility by HPID and password. You need to log in
Okay.
into HFR. You need to
Okay.
click on the transfer request section. There you can
Hmm.
see the incoming request. You need to approve the incoming request.
Okay. Apart from facility manager, suppose one facility manager is somehow missing and he cannot connect. Then who will be
District nodal
approve this thing?
officer, district nodal officer and state mission director will be the authority who will transfer the facility upon request.
State mission director can do. Suppose the transfer person has raised the request, but who will approve the request? He is missing. So state mission director can approve this.
See, you are mixing two questions. First of all, if the request has been raised to a new incoming facility manager, it's upon the facility manager to accept the request. In this,
Okay.
no nodal officer or verifier can do any activity.
Okay.
Okay. Another question comes into play is that if the user transfers from one position to another or from one facility to another, and he doesn't provide the HPID or doesn't transfers the existing facility from his bucket to another facility bucket, that is taken up by the nodal officer.
Okay. Now it
Got
is
my
clear.
point? Yeah,
Okay.
there are two questions, different questions in it.
Okay. Thank you.
Okay.
Thank you
Okay.
for the.
Okay.
Thanks a lot, everybody. I believe most questions have been addressed. If there are any more queries, there was information shared on the chat by Sankiti also that you have your toll-free number to raise your queries on. Otherwise, you can visit the website. Okay, Mr. Uday has another question, Shashi. Um, by next month, APIs related to the HPR registration will be rolled out. So after that, can we, the PHR app providers, do the same type of registration process?
Yes. You can do that after that. If you are dealing with doctors or nurses, the categories which are currently supported on HPR, if you are dealing with them, then you can do that once the API is rolled out.
I hope that
Satish,
answers the question.
So there are
Satish,
some more questions in
yes,
the
it
chat
is.
box. Have they been
Yeah.
answered or?
Satish, I have a different question, but it is not related to SPR. It is related to grievance. As you said, for SPR registration, the turnaround time has to be defined by the state because as it is a state subject. So what about the grievance turnover time? So it is quite different. It is a little different from questions, but I just want to know.
No, sir.
have any-
It's totally related to HPR. So there is grievance portal wherein you can select HPR section and you can address the question, and our team usually gets back to you within 1 to 2 weeks. So turnaround time is 1 to 2 weeks for that as well. For our grievance portal, you can write your queries and our team will get back to you. If conversation is required, someone from our team will get over a call with you. And if it can be resolved over email, then we can directly resolve and share the screenshot over the grievance portal that this has been resolved.
Okay, but my question is like the turnaround time for grievance is to be set by the state again, like we have SPR.
No. This grievance is related to HPR that the issues that you are facing in HPR at the NHA portal, that ABDM portal. So this grievance is related to that. And if the issue is related to state, so usually the reply comes related that you can coordinate with the state council team or state work verifier, and you can expedite the process. Usually the reply goes in those manners only.
Okay.
Because then we can't force them to expedite the process.
Okay. Thank you.
Thank you, sir.
Thanks a lot, everyone. Thank you, Shashi, for answering all the queries. Yes, you were asking about the chat. We have answered most of the queries to the best of our ability on chat, Shashi. But if any question seems unanswered, then we urge everybody to also
Is there any
post
other
for
question? Then you
sharing
can
the
raise your hand and you can directly start asking.
Yes,
MIS,
please.
ABDM,
Yes,
Manipur.
please.
Manipur team, please go ahead.
You're
MIS,
muted.
Manipur.
Yeah, he's asking.
Sir, ma'am, you are not audible. MIS, Manipur.
You're still in mute. Slow. So this, give me a minute. He's coming in my place now.
Yeah, I just see your share the one list. Hello, can you hear me?
Yeah, you are audible now.
Okay, what you share the lower cost of the digitization, right? So on that list, share number 5, Prelio Health, right? The amount is 1500. Is the dollar or is the rupees?
It's in rupees.
When I check in the online, okay, so it is the dollar showing in their website. Can you verify this one? Because
which website? Which website, sir?
Yeah, this is the Telio Health.
Anvesha, can you again share that screen?
Okay, sure. It says the Telio Health, right? One second, I will show you that. Okay.
To the best of our knowledge, it is in rupees, but we'll just confirm it once, sir.
Yes.
It's in rupees per month, sir, as mentioned on the top line of the screen.
Yeah. I'm just sharing the screen, right? Then you can understand what I'm sharing, right?
So you are referring to their website, right?
Yeah, their site. Yes, I'm just sharing. Okay. 1 second. Yeah, can you see my screen?
Yes, sir.
You see, this is the Kelio Health, right? And the Kelio Health LMIs, right? So where price is this? This is a dollar 1500. Yeah, you see.
Anvesha, where did you get that number from?
So this has been officially quoted by the team to the ABDM integrations team and has been in the works for a while. I believe, sir, it might be best to reach out to the technology partner then to seek a
Yeah, please, because
There are
we
also some instances wherein they have reduced the prices for ABDM supported apps or partners.
Okay, someone is asked to us, right? They have gone to the this website and they are seeing the $1,500, and what we are saying is the rupees 1,500, right? Is the big amount difference, right? So is there any have any documents what had decided the cost of these software? So then we can have the proof and show to the partners.
Sir, if you please share your email ID, we can reach the technology partner and circle back to you with the same. Please leave your email ID in the chat, and
Okay, sure.
we will reach back. Thank
Sure.
you.
Okay.
Our team will get back to you, sir.
Yeah, sure. Okay, thanks
Thank you.
for.
So any other queries related to HPR or some other domains of ABDM? There are some more raised hands, I guess. Uday Kumar and someone else.
Yes, sir. Sir, can I ask now?
Yes, sir.
So I am asking this on the behalf of a doctor. So she is an Ayurveda doctor. She is not. She is in abroad. So if the doctor completed the graduation in India and they done the masters here, but they moved abroad like UAE, so can they still register in the HPR? Mm, that is my
So
question.
do they have any registration certificate from any of the state councils or national council?
Yes. They have the
And
they
is the
exactly.
registration still valid?
Yes.
So if that is the case, then they can do that.
Okay, they can do that, and they can also practice by online appointments.
Through teleconsultation. Once the approval is
Yeah,
done, then they can start teleconsultation. Once the approval is done.
teleconsultation through the ABDM. Okay. Sure. Thank you.
Okay, sir. Thank you. Thanks for joining today. Rohit Bhatt has some question, I guess. Sir, please go ahead. Hello. Hello. So Rohit sir, if you want to ask some question, you can go ahead, or then we'll close the call if there are no more questions. Which
Shakti, there is a question
approval
in the chat.
is required for
Yes.
managerial registration? Okay, so the request should come from your state council, and there is a specific format in which we ask for the name, their email ID and mobile number. And after that, the profile is created and they are given an access of state level verifier based on whether they're from council or work verifier. And after that, once the credentials are created, they can start verifying those profiles. But the request has to come from state, from official ID, preferably. Hello.
I hope that answers the question, Dr. Pankaj. Okay, so I think with that we can end the session for today. For the benefit of the audience, the next HPR adoption webinar in the similar template will be organized on 6th of April, again a Thursday at 4 p.m. The link would be uploaded on the ABDM website. And in a short span of time, it should also be available on the HPR website with the calendarized schedule for the webinar, and you can register yourselves for those. And please share the word with the larger fraternity and the community if this was helpful for you. Thank you so much, everyone, for joining. Have a good
Thank you,
evening.
everyone. Thanks a
Thank
lot.
you. Thank you.